Welcome to Schein Chats. Rich, I have a couple of questions we want to run through about the overall landscape of the dental market and what's happening in terms of technology. Does that sound all right?
Sounds great. Thanks, Josh.
Awesome. So from your experience, vast experience, how have you seen the landscape of the dental industry kind of changing when it comes to cone beam or imaging for that fact?
Yeah, it's a great question. I think, flexibility is the word that comes to mind. It's something that we need when we're looking at innovation for the future. Technology is forever changing, and it's not going to stop anytime soon. So I think the landscape is very much moving in many different directions, and we have to adapt to the changes and adopt to new technologies.
Love that. To go a little bit further into that, why do you think it's crucial for doctors to kind of understand and implement this type of technology into their practice nowadays?
Yeah, another good question. I think, purchasing and implementation are the two key components that we can talk about here. From a purchasing standpoint, Josh, I think having the autonomy to choose how and why they purchase is one of the ways that you can really grow with innovation, right?
Awesome.
Implementation, I think, is pretty simple. It comes down to having a great distributor, dealer partner that's in, having continuity with the manufacturer to have a professional install done. And then education, to me, is the other component of the implementation that will make a practice or a DSO extremely successful.
Fantastic. On top of that, in the field when I used to sell cone beam, there was a lot of myths or misconceptions about the cone beam space, 3D imaging. Do you see those myths still kind of out in the field? And what do you have to say about those?
Yeah, I do. I think they've changed over the years, Josh. I think now the myth is it's still the one that's come up as cost, right?
Yeah.
The price is too expensive. That certainly is a myth, because there's a solution for any type of dentist, whatever they're doing in the practice financially, that we can get to their solution, right? So I think that's one myth. I think also the difficulty of learning and adopting the new technologies. It isn't that difficult when you have the right education in place, which I think probably we'll talk more about, but that's a key component, as well. But it's not a myth, I don't think.
Absolutely. You touched on education earlier, and I think that's an extremely important topic. Can you touch a little bit on why education is so important in this realm, and any experience with not getting education or doubling down on education?
Yeah, I think there's two things. The two E's that come to mind, right? Expectations, providing proper expectations to the clinician and the practice of what it's going to look like, and then obviously executing on the training and the education. So I think what I've seen over my 14 or 15 years in imaging is that when a clinician or a practice is educated at a high level, they're going to use that product most effectively. And that leads to optimal patient care, which is really the point of this technology.
100%. And in closing in our conversation, with your vast experience and your team's vast experience, your company's vast experience, any advice that you give to doctors looking towards this technology, or even younger doctors that are just starting out trying to implement this technology? Any overall advice for our shared customers?
Yeah, I think I would say that number one, find a trusted dealer and manufacturer to support you. They're in alignment of the goals for the practice. That's number one. I think to evaluate cost of ownership versus just the price. I think that's something that doesn't happen enough, because warranty and software and hardware upgrade fees,
always
something that always goes under, missed. So I think that's another one that people need to consider, is the overall cost of ownership. And the last thing I would say is flexibility for the future. A lot of these folks, our clinicians, are purchasing the product for now. They should also consider the future. What are they going to do in 3 to 5 years and maybe 10 years?
Love that.
I think that's where we want. That would be my advice to the folks listening in.
Fantastic advice. Well, I appreciate this short Schein chat about the ever-changing industry when it comes to cone beam and technology. We appreciate your insight. Like always, I've learned so much from you. I hope everybody else can learn so much for you. So I appreciate you, Rich Hoffman.
Thanks, Josh. Thanks for having me.
Absolutely. Thank you.